In this session at Medical Sciences, I want to discuss with you about the action potential of the cardiac muscle. We want to see how contractions is triggered in the cardiac, or what we call the heart muscle. And we know that compared to skeletal and nervous tissue, among the excitable tissues, cardiac action potential takes longer, whereby we find in the neurons, that is nerves, and skeletal muscle fibers, the action potential takes 0.001 second, or what you can call 1 millisecond. But for the cardiac, you find it takes longer, that is 0.3 seconds, or which you can call 300 milliseconds. So you can see that the action potentials in cardiac muscles take longer, and even the refractory period. So I want to discuss different phases during action potential and contractions in the cardiac muscle. And the resting membrane potential of the contractile fibers in the cardiac muscle is negative 90 millivolts. That is the resting membrane potential. So when an impulse arrives within the cardiac muscle, we're going to see that there is a rapid increase in the amplitude. And this rapid increase takes like 0.1 millisecond, takes like 1 millisecond. It is very rapid, and it is caused by influx. Then after attaining a peak that is at plus 20 millivolts, there is always the initial repolarization. And after initial repolarization, we go into a plateau phase. And after the plateau phase, it undergoes repolarization. So this is the curve showing the action potential in the cardiac muscle, whereby this first phase we are seeing here is due to, this is the first phase, the second phase, the third phase, and the fourth phase. Whereby the first phase, this one we are seeing it is the initial depolarization. This is initial depolarization. Then this is initial repolarization. Then 3 is the plateau, or you can call it the final depolarization, which is sustained. Then number 4 is the final repolarization. So those are the 4 phases of the contractile or the excitability of the cardiac muscles. So after seeing these 4 phases, we're going to see what causes them or what brings them to happen. And this first phase, that is rapid depolarization, initial rapid depolarization, this one we call it rapid because it is due to opening. It's due to opening of fast sodium channels, sodium gated channels. So we're going to see if this is the cardiac muscle. Here it is the outside of the cardiac muscle, and this is inside. We have what we are calling voltage gated sodium channels. And these channels, they rapidly open and rapidly close. And because they are fast acting, they quickly open and quickly close. So when they open this activation gate, there is influx of sodium ions which were initially outside the muscle. they enter inside, causing the inside to become positively charged and outside negatively charged. And this is what we call depolarization. So this initial rapid shooting of the action potential is due to opening of the fast acting voltage gated sodium channel. And when they open, they cause influx, rapid influx of sodium ions, causing inside the cell, inside to become positively charged, and hence propagating an action potential, hence firing. So this is the firing point, the firing point. So that is the phase one, which is initial depolarization, due to the fast-acting sodium channels which open quickly and closes quickly. And after opening quickly, at least at the peak, which is always at negative plus 20 millivolts, which is different from skeletal, which is at 35. This one is at positive 20. That is the overshoot or the peak. The peak is always at plus 20 millivolts. So after this initial depolarization, it is followed by initial repolarization. And this initial repolarization, which is labeled number 2, is due to the opening. It is due to opening of fast-acting potassium channels. These are some potassium channels which open quickly. We know majority of the voltage-gated potassium channels, they slowly open and slow closes. But this one, there is some fast-acting potassium channels which open here before opening of the calcium voltage-gated channels. And this one causes an initial repolarization. But this initial repolarization, which is brought about by the opening of the fast-acting potassium channels, leading to efflux of potassium ions outside, leaving the inside becoming negative and outside becoming positively charged. That is what we are calling initial repolarization. Opening of the potassium channels and fast closure of sodium channels. Because here, after the sodium channel opening, they close immediately, and there is a smaller opening allowing the outflow of potassium ions, bringing about initial repolarization. And this initial repolarization is followed by the plateau. And this plateau is sustained depolarization. It is sustained depolarization. And this sustained depolarization, which is number 3, is due to the opening. This is due to opening of slow, high voltage, gated calcium ions, calcium channels. So these calcium channels, if this is the calcium channel, high voltage calcium channel, it is slow. It takes longer to open and it takes longer to close. So when they slowly open, remember the sodium closed already, meaning we're going to see influx of calcium from outside to inside. Remember the sodium are closed and the fast-acting potassium has also closed. So there is only, we are losing calcium from outside to inside. It is going to cause the inside to become positively charged and outside negatively charged. So this opening causes influx or entry of calcium ions inside the cardiac muscle fiber, that is into the sarcoplasmic reticulum crossing the sarcolemma. And when calcium accumulates within the sarcoplasmic reticulum, it even causes the sarcoplasmic reticulum to release more calcium, causing the inside to become more positively charged. But is being counterbalanced here. Why it is a plateau? As there is influx of sodium ions, influx of calcium ions, there is even some loss of the potassium. So there is a balance which is preventing increase in depolarization or increase in an action potential. And that's why it is remaining flat, why we call it a plateau. So there is a balance between influx of calcium and efflux of potassium, but they are balancing. So that's why it is kept in check at a constant level. Then later we see phase 4, which is the final repolarization. And this final repolarization is due to the opening of slow. This one is due to opening of slow potassium channel. And when they open, there is efflux of potassium ions. Potassium ions, they are moving as the calcium are crossing. So there is the degree of efflux of the potassium ions is higher than the influx of calcium. And this is what is bring about repolarization, restoring the resting membrane potential of the cardiac muscle. And after restoring the resting membrane potential of the cardiac muscle, it has even a longer refractory period, which allows the cardiac muscle to continuously contract. So this is what we can discuss about, and what I can remind you about the plateau, it takes about 0.2 seconds. So it is the one that takes longer. The plateau takes longer. That's why we see the action potentials in cardiac muscle fiber takes longer compared to neurons and skeletal muscles. So in summary, in this session, we have looked at 4 phases of the action potential in the cardiac, whereby the first one was initial rapid depolarization due to opening of the fast high voltage sodium channels. Initial repolarization due to efflux of potassium ions, then followed by the plateau, which takes like 0.2 seconds, and is due to the opening of slow high voltage calcium channels. Then we have seen final repolarization, which is due to the opening of slow acting potassium ion channels, and then for restoring the resting membrane potential, which is between 85 negative to negative 95 with average of 90 millivolts. Then we have said it has even a longer refractory period. What is a refractory period? Is the resting period where the cardiac muscle cannot transmit an impulse, which is divided into 2. Relative refractory period and absolute refractory period. That is what we can talk. And among all excitable tissues, cardiac muscle has the longest refractory period. And that's why our heart keeps pumping from the time we are born or we are formed in our mother's womb until death without being fatigued, because of long action potential and long or high refractory period. And that's why the heart muscles doesn't become fatigued due to the longer refractory period, the time it takes to restore the membrane potential. Thank you so much for learning with us at Medical Sciences. Hope you have enjoyed, and continue learning by sharing to many others so that we can continue to learn more. Thank you so much.